As a budding doctor, have you ever been asked by a family member or a friend if they should get themselves screened for cervical cancer? If not yet, then this question is something that you would face in real life as well as in your exams. So who should get themselves screened for cervical cancer? When, how often, and why? Cervical cancer, the most common gynae cancer in Indian women, is caused by HPV infection. Now, screening allows for prevention of cervical cancer by early diagnosis and treatment of pre-malignant lesions of the cervix. Now, what does WHO has to say about it? It recommends that screening should start from the age of 30 years onwards. What tests should be done? Primary HPV DNA testing. How often it should be repeated? Every 5 to 10 years. Now, in low-resource settings, this would aim to achieve at least 2 lifetime screens, one at the age of 35 and one by the age of 45. Remember, HPV DNA testing is not recommended in women who are younger than 30 years of age. Is Pap test, that is cytology, a screening test? Yes, it is. If done alone, it should be repeated every 3 years. And what about visual inspection with acetic acid? What is its role? Now, sometimes in low-resource settings, Pap test and HPV DNA testing facilities may not be available, and then VIA becomes a very useful alternative for screening. It must be repeated every 3 years. So remember these important points for your exams, and as well to give any actionable advice to somebody who seeks help from you.